According to the Australian Institute of Health and Welfare and many other respected health organisations, Indigenous Australians experience disproportionate levels of educational, employment and social disadvantage. Many Indigenous Australians also experience poorer health when compared to our other Australians, often dying at much younger ages. A healthy beginning in a nurturing environment with protection from physical and mental abuse and opportunities for personal development such as education and employment are all important for a healthy life. The purpose of this video is to discuss the reasons underpinning the poor health status of Indigenous Australians and to highlight the appropriate measures for taking action to reduce the health inequalities between Indigenous and non-Indigenous Australians. This video will explain the key social, physical and behavioural determinants that influence the health status of Indigenous Australians and will show the impacts that these factors have on the health of Australia's Indigenous population and the burden that is placed on Australia's healthcare sector. Since the European settlement of Australia, Indigenous Australians have been a racial minority in society and have been victims of cultural conflict. Disease struck a fatal blow to the Aboriginal people of Australia, who are more prone to death as a result of the diseases carried by Europeans, a trend that has sadly continued to the present day. Indigenous people are generally worse off when it comes to the social determinants of health. A lot of health services simply aren't as accessible and user-friendly for non-Indigenous people as they are for Indigenous people, adding to higher levels of disadvantage. This can be greatly contributed to the fact that more Indigenous people than non-Indigenous people live in remote locations and not all health services are offered in these communities. Some health services don't consider the cultural needs of Indigenous people and therefore are not culturally appropriate, which further enhances the problem of accessibility to health services for the Indigenous people. Socioeconomic status also affects the healthcare of Indigenous Australians, as they have a gross income nearly half of that of non-Indigenous Australians. Not all health services are covered by Medicare, for example physiotherapy and most dental treatments and examinations. And as a result, the health of Indigenous Australians suffer, as many cannot simply afford to pay for these health services. Indigenous Australians have a much higher prevalence of cardiovascular disease and type 2 diabetes. This can be attributed to both social, behavioural and physical determinants of health. Indigenous Australians are more likely to reside in towns with higher rates of tobacco use and excessive alcohol consumption, which creates an unhealthy social environment from which poor behaviour stems. There is often limited accessibility to sports and recreational facilities in remote communities, which contributes to an alarming rate of Indigenous Australians not meeting the national physical activity guidelines recommended by the Australian Institute of Health and Welfare. A low income combined with limited access to fresh food and produce means most Indigenous households suffer from poor nutrition, which when amalgamated with lower physical activity levels results in a ticking time bomb for cardiovascular disease and type 2 diabetes. A higher prevalence of excessive alcohol consumption and higher rates of tobacco use in Indigenous communities contributes to a high frequency of liver disease and lung cancer and associated respiratory conditions in Indigenous people. Indigenous health is affected by multiple influences, all of which contribute to harbour the healthcare problems that the Australian government is presented with today. Each social and physical and behavioural determinant plays a role in widening the gap between the health status of Indigenous Australians and non-Indigenous Australians. The underlying problem is that many Indigenous youth aren't educated on the detrimental effects of poor lifestyle choices that can have an effect on health, or are simply unable to live a healthy lifestyle due to circumstances that they can't help, like family financial difficulties or an upbringing scarred with abuse and ill treatment. The Australian Government has implemented strategies like the Australian Institute of Health and Welfare's Closing the Gap program, which is a strategy that aims to reduce Indigenous disadvantage with respect to life expectancy, child mortality, access to early childhood, educational achievement and employment outcomes. In 2008, Kevin Rudd, the then Prime Minister, announced a statement of intent to work together to achieve quality in health status and life expectancy between Aboriginal and Torres Strait Islander peoples and non-Indigenous Australians by the year 2030. The strategy has had mixed results. The gap between the health status of Indigenous Australians and non-Indigenous Australians has reduced quite significantly since its implementation. However, there's still a distinct difference in health status, and statistics show that a far greater effort towards addressing the poor health status of Indigenous Australians is needed. More emphasis needs to be placed in schools to provide an education to Indigenous children and to break the cycle of poverty by increasing employment opportunities. More funding should be allocated towards remote communities that suffer far greater than metropolitan communities. It is of significant importance that we preserve the health of Indigenous Australians, as the generosity of the traditional custodians of the land is what has made Australia such a great and wonderful place to live. Thank you for listening.